Darrell Rigel, Clinical Professor of Dermatology at New York University, and also Adjunct Clinical Professor of Dermatology at UT Southwestern in Dallas. My presentation at the American Academy of Dermatology conference was related to melanoma and how dynamic the field is. First of all, the incidence is rising across the world despite everything we're doing. The number of deaths are going up, but the good news is that the percentage of people dying is lower. The survival rate is getting better, and that's primarily for several reasons. One is we're detecting melanoma earlier. The ABCDs of melanoma that I published 40 years ago is still being used, and with that we can detect melanoma earlier, but also artificial intelligence is beginning to make its impact in dermatology with early diagnosis. Very excited about that, and these new AI tools, in fact, will augment our ability for diagnosis. For prognosis, the hottest thing is probably gene expression profile testing, because now we're using genomics to better assess prognosis on how patients will do. And then finally, advanced disease, we now have treatments for it. The new papers that have come out show that if you survive 3 years, and about 50% plus do, almost everybody of that group will survive out to 10 years. So it's not a cure for melanoma yet, but we're getting closer to it. I think the most exciting thing I'm seeing at the AAD conference is the use of genomics to really integrate how patients will do, both for prognosis of disease as well as personalized medicine. We're starting to see that perhaps a disease like melanoma may be more than one disease because the different tumors have different genetic patterns. We're just starting to see that and starting to apply that. For atopic dermatitis, for example, there's now a genomic test to see who will be a better responder for JAKs versus dupilumab. So again, to me, that's the hottest thing at the meeting, the integration of genomics into clinical practice. I think there's two important areas of research that are occurring. First of all is prevention. Sunscreens, there's some improvement in the ability of sunscreens, but also public education, getting the word out to protect themselves. When you think about it, skin cancer is probably the most preventable of cancers. We know what causes the overwhelming majority, and we know a behavioral change can make a difference. So that's number one. And the other thing is technology. The technologies that we're seeing for skin cancer and other diseases will make a difference and really make a difference in our patients' lives and their prognosis.